I'm Jeff Griffin alongside John Dunn. It's Medicare Monday on a Medical Monday, a HealthTeam Advantage. Welcome back, John.
Glad to be back, Jeffrey. So we have a couple things going on. We have now an SEP going on, a special enrollment period, due to Hurricane Helene. And what that means is if anyone did not make a decision during our annual enrollment period, they now have a chance to make a decision still until February the 28th. So they have that time frame that they can still change their plan.
When you have the aftermath of Hurricane Helene and people been dealing with trying to live and survive and, where am I going to spend the night? Where's my next meal coming from? And sometimes things on the to-do list get pushed back.
Yeah, you have higher priorities at that point.
And it's completely understandable.
Absolutely.
And so then the governor's office makes one of these declarations. So there is an automatic extension, and that's in play. Whether you maybe endured some significant damage on your property or not, this is in play for all of us, right?
It is. That's right.
Don't worry.
That's right. You can do it today.
All right. So we got until February 28th. And for some folks, again, once you get past the end of 2024, they've got their plan in place. They made their decision and it's all filed away. Paperwork's done. Right. We are good to go. And then you get to that first week of January.
Yep. We have a different enrollment period starting January 1st.
You go to a doctor and maybe you find out that doctor is not in network. You find out doctor says, I need to send you to a specialist. There'll be a myriad of things that can come into play, right?
Yes, there could be. You're prescribed a new medication and it's on a different tier, formularies with different companies. So you find out that drug is going to cost me a lot more over here than at another company. You get an enrollment period to change from January the 1st till March 31st.
Okay. You can go in and, it's that simple. We don't have to make an appointment. You don't have to provide any documentation. Nope. You call and HealthTeam Advantage will take care of all the crossing the T's and dotting the I's, right?
That's exactly right. You don't have to call your old insurance company and tell them you want to cancel. Everything is handled right with us.
But that does not sound like it could possibly be any easier.
So easy.
Peace of mind is invaluable. And sometimes when the pressure mounts, John, and you get that place, you can finally breathe.
That's exactly right. No better feeling than that.
There's also a website. You get a ton of information, htanc.com. One of my favorite parts, we'll get to that, of course, the improved larger font, which is a truth for a lot of us. And John, we can also come see you in person, local benefits center in High Point, right?
That's exactly right. We're there Monday through Friday, 9 a.m. to 4 p.m.
5815 Samet Drive. So folks, we've got February 28th, and then there was March 31st for the open enrollment.
Right.
So, all right. So that's if you're changing from one plan to another.
Yeah. So the special enrollment we talked about due to the emergency with Hurricane Helene, you can only use that one if you did not make a plan selection during the annual enrollment period. Open enrollment period, you get a one-time shot to change from one Medicare Advantage plan to another.
So second bite at the apple.
Right.
The special enrollment period, that's in play now through the end of February. And that's if you did not make a decision for whatever reason.
Correct.
And it's not just the 33 counties where HealthTeam Advantage is in play.
That's the entire state.
Right. Then the open enrollment period, that runs through the end of March. That is your proverbial second bite at the apple.
That's right.
I made a decision. I think maybe I can make a better decision, or circumstances have changed. Circumstances can turn in 12 hours.
And that's usually how it happens.
And so people can call and don't worry. Your healthcare concierge can talk you through everything again. That's never a problem. You mentioned specifically the medications.
Yes.
I got a new prescription.
Yes.
I wasn't expecting. We had talked about my monthly out-of-pocket was going to be $50. Now I'm looking at the plan I'm on. My monthly out-of-pocket is going to be $150.
Right.
There may be options available to you.
Absolutely. We want to hear from you on those. We want to help you out. So give us a call. We will look at all your prescriptions. And that happens more than what I'd like to see it happen, where you get a surprise. And now with so many new drugs coming on the market, it happens more and more.
Oh, yeah, and there could be, when you made your decision, there, as you say, there could be a new drug which wasn't even on the table.
Exactly.
When you made your first decision, and now the doctor goes, oh, there's a new thing out. I'd like to try this. And of course, that impacts your wallet.
Absolutely.
And for folks on a limited income, you want to know.
Since we're talking about prescription drugs, it's a good time to bring it up. That we have a social worker on staff that will help people navigate, because there's so many ways you can get discounts on new prescription drugs.
Absolutely.
And you call and ask for that help, and it's there for you.
Yeah, and with the social worker, that's part of what they do. They
Absolutely.
are aware and stay up to date with all of the available resources and what changes are happening in store. It's almost impossible for one individual to keep up with all the changes they come through on a daily basis. So don't get caught by surprise, and please don't fret or worry. There are options available to you. John, some of these questions that come up time after time, I feel like we need to go over again. There is not one, not two, but 4 parts to Medicare.
It's the ABCDs of Medicare. So
All right.
we'll start at the top. Letter A, Part A is original Medicare. That is your hospital coverage.
Okay.
And think of that as only your hospital coverage.
Okay.
So you admit it to the hospital. Part A is what is used to pay those bills.
Hip replacement.
Well, potentially.
Pneumonia.
Yes.
All right.
You admit it to the hospital or whatever. That's your Part A.
All right.
Then you get into Part B. That's
Yes.
going to be your outpatient stuff. X-ray, lab work, MRIs,
Okay.
CAT scans, your outpatient surgeries.
Okay.
And then things as simple as your office visit to your primary care doctor.
My regular annual physical.
That's right.
Got it.
That's all Part B, as
Okay.
in boy.
That is OM.
Original Medicare.
There you go.
Yes,
I
sir.
got it. Okay.
Okay. So, you know, all of our working years, we've seen that deduction out of our paycheck for Medicare.
Yes.
That's what that's going to cover.
Got it.
Those
Okay.
2 items.
Okay.
Then we have Part D. I'm going to skip C. Part D.
Yes,
D
sir.
for drugs. So 2004, 2005, the federal government came out and said, hey, A and B is not enough anymore. We need to implement Part D, a drug plan. And they let outside insurance companies handle this. Now, they all have mandates that they have to follow, guidelines. So plans look fairly similar on drug coverage.
Yes.
But that's your Part D. If you don't have D or B, you can be penalized. So keep that in mind when you're talking to an agent or calling us at HealthTeam Advantage.
Now that penalty,
Unfortunately, that's the gift that keeps on giving.
there's a penalty every year.
Every
If I live
year.
another 30 years,
That's right. You've got it till the end of your
I
life.
got 30 penalties. Wow. So please make that decision the first time out.
Yes, they will give you an option of having that deducted automatically from your
Okay.
Social Security,
All right.
or you can send them a direct draft every month.
So pay attention, everybody. All right.
Yes.
That does it for Part D.
Part D, drugs, that's simple. Anything at the pharmacy there that you're filling a prescription for. Part C,
Yes.
that is the fun stuff we talk about, Jeffrey.
All right.
That is where we take parts A, B, and D and wrap it up into one neat package and call it Medicare Advantage or Part C.
This is the worry-free. This is the deluxe. This is what you want to make your life simple.
So you've got one card that covers all of your hospital, all of your outpatient, really all of your medical services on that one card. Also includes all of your prescription drug coverage on that one card. And then, you know, the insurance companies are going to kick in additional benefits for dental because, believe it or not, Medicare does not cover dental.
That always surprises me.
Yeah, because, you know, most of us have had group insurance our entire life, which included dental.
Yeah.
Part C also will include vision coverage because Medicare does not cover routine vision.
As you get older, so you maybe need a little more attention with your dental care and your
Absolutely.
vision and your hearing, right?
Yes.
And then you talk about the component of mental well-being, John.
Huge, Jeffrey.
The human connection.
Yes, absolutely. So you get the fitness benefit, which includes gym memberships. So it's beyond just physical. You're connecting emotionally with people, your peers.
Walk the track,
Yeah.
get on a stationary bike, and talk about the grandbabies.
Yeah.
And you're getting a little bit of exercise too. That's good for the heart, good for the body, good for the soul. If you sort of abandon any element of your well-being, there'll be ramifications that will manifest in other ways.
We're social beings and we have to be around other people to thrive.
So we got parts A, B, C, and D all wrapped up with a pretty red bow.
And most of those here in the triad are zero premium.
Now, John, you know, and part of that too is that if you choose different companies, it's a different company for vision and dental and your hearing and your prescriptions. all of a sudden I've got 4, 5, 6, 7 policies, 4, 5, 6, 7 phone numbers from different customer service departments.
That's a nightmare to navigate.
Yeah.
But if you only have original Medicare, you're still going to have to buy a Part D drug plan. You're still going to have huge deductibles and co-insurances on original Medicare. So you may want to buy another Medicare supplement to go with all of that.
Mm-hmm.
And then you still have no dental coverage, no vision coverage, no hearing coverage.
Now, the option there is to get in touch with HealthTeam Advantage. Got one policy, one number,
That's right.
one healthcare concierge, and it's all under the same umbrella.
That can't get any easier than that.
And plus, with HealthTeam Advantage, you're not calling up a stranger.
No, when you become a member, you're assigned your own health concierge, and you get their business card, magnetic card in the mail with their picture on it, their phone number. That's your go-to person for any question, health related, drug related, dental related. You've just got that one contact.
And it's not just, hey, I don't understand my bill. Can you talk through this with me? This is, I need to get an appointment. I don't know where my doctor's office is. Your healthcare concierge is there and on call and has access to the resources to help you navigate all of that.
We know what concierge means and the service that you expect from having someone with that title.
And this is not somebody who lives on the other side of the country.
Oh, no.
These are
Jeffrey,
people
they are right here local to the tribe.
live in your neighborhoods. They shop at the same stores. So they get it, appreciate your way of life. You're not having to start over every time you call. You imagine how frustrating it might be, folks, when you call that toll-free number. Well, I need to verify your identity. And you're just, here we go.
Yeah.
You call healthcare concierge. Hey, Mr. Dunn,
They know
so
you
good
by
to hear
first
from
name.
you.
That's right.
Sure. There's something comforting about that. It really does take the village, and we're all in it together.
We are. This healthcare system we all have to live in and navigate it has become so cumbersome and difficult. It's great to have that advocate on your side, working for you, helping you with any process.
And the less you worry, the less you stress, the more you're going to enjoy life, the better your health and well-being is going to be.
That's right.
And we want to keep you around as long as we can, love on you as much as we can. John, we talked about parts A, B, C, and D. The special enrollment period is in play and through the end of February, the 28th. And that's if you have not got a plan in place.
That is if you did not make a decision during annual enrollment period.
All right. And then open enrollment, OEP, is in play through the end of March. That's your second bite at the apple.
That's right. That open enrollment goes from January 1st to March 31st. So you may have chosen a plan and you picked the wrong plan.
Sure.
You get that 3 months to choose another plan that you think you might like better.
Now, folks, it is local, reliable, accessible. When you call your healthcare concierge, these are local folks. This is a local company, John.
That's right. We are local, based right out of Greensboro. We are jointly owned by Cone Health and Novant Health. Our network extends much further than those two hospital systems, but we are locally owned by those two hospital systems.
And there you go. Now, we like to say it's across all 100 counties in North Carolina, but it is a growing process. Now we're up to how many counties?
We're up to 33. We were 12 counties for 2024 and 33 counties for 2025. So fastly growing.
Yeah, when it's good, it spreads. So, folks, and John, maybe some folks go, they kind of, I'm not Medicare eligible this year, but 2025, ring the bells. This could be the magic year when a lot of us turn 65. Is it too early to start getting stuff in place for 2025? I'll become eligible.
I like to see people start the planning process 6 months before they turn 65, no later than 3 months before you turn 65. Get in touch with Social Security. Make sure you got A and B in place to be effective the month of your 65th birthday, so that's not a holdup. But 3 to 6 months out is not too early to start planning for that. Those who have been working past 65 and are going to retire, same thing applies. 3 to 6 months before you're going to retire, start having those conversations with Social Security.
So what is the best way? You say reach out to Social Security, and some of us go, I don't know. What does that mean, John? Does that mean a phone call? Does that mean an email? Does that mean go and visit? What do I say? Where do I go? So can you push us in the right direction?
Yes. So you have three options. You can go to the local security administration office, one in Winston, one in Greensboro. You can go set in line there, wait for your number to be called. You can call them on your telephone. You may have to wait on hold 30 minutes to an hour to get a rep, but you have that option. Or you can create an account at socialsecurity.gov and set it all up online. And that is the quickest. It can be the easiest route if you are familiar with navigating websites and that type of thing. But that's the quickest and easiest. Give us a call and say, I'm thinking about retiring in 3 months. What do I do?
And so your healthcare
We'll walk you through
concierge
that.
can say, this is what we need to do. Let's check this off. Have you done this or that?
Right.
Millions of people have done this.
That's exactly
you
right.
too can do it.
Yeah, absolutely.
And really, we say there are no wrong decisions when you're doing this. The only poor decision that you might want to reconsider is to do nothing.
That is the wrong decision.
Right.
Yes.
There. So let's go ahead and move. Even baby steps for progress.
Oh, absolutely. Yeah. And this will be a process. Don't expect everything to happen overnight. Whenever you have the government at work, it can take a little while. So that's why we say no, at least 3 months before you're going to turn 65 or retire. Let's start this process.
Yeah, if you're impatient like me, just know going in, it's probably not going to get wrapped up in 24 fantastical hours. So go ahead and start now. Give yourself a little bit of grace. All right, folks, again, you've got through the end of March for your second bite at the apple. You've got through the end of February if you do not have a plan in place yet. But then, John, there are some other plans which may become necessary to take under consideration during the course of a year. One of these is the chronic special needs plan. If you could take just a moment and tell us a little bit about that.
Absolutely. So it's been 5 years ago now that HealthTeam Advantage rolled out a chronic special needs plan here in the Triad, and it's specifically for people who have diabetes or congestive heart failure. We were the first company to roll this out here in the Triad. There have been some others to follow since then. But it's a great plan. You have a year-long enrollment for that plan, meaning you don't have to wait for annual enrollment or open enrollment. It is all year long, and the qualifier is just to be on Medicare and to have one of those two chronic health conditions.
So that I was going to ask, what triggers your eligibility for this kind of plan? One of those is having that conversation with the doctor. It says, this is what we're looking at next.
That's right. And most people know whether they have diabetes or not. They've had that conversation with their doctor. The hard one that a lot of people don't know is they may have that diagnosis of congestive heart failure, but it may have been told, but it doesn't register. It's not thought about as much as diabetes. Diabetes is the easy one. But yes, with either one of those conditions, you automatically qualify for that plan. And it's a great plan. You get, on top of the great concierge service, you get your own care manager.
Oh, yeah.
Which goes a long way into helping you navigate those two conditions and making sure, you're taking your medications that are prescribed as they are prescribed. We don't want anyone missing dosages. We don't want anyone cutting pills in half because of the cost.
Right.
So a lot of extra care goes in to those members who have that chronic special needs plan.
And what are some of the telltale signs? And some of us, just for whatever reason, if you're wondering about the diabetes, some of the telltale signs, if you're doing insulin, your doctor talks about that.
Right.
And check your blood sugar, and you hear these words like glucometer and testing strips,
A1C,
and your blood sugar and all that. Those are some of the telltale signs about a diabetes diagnosis.
Yes.
And then you talk about chronic heart failure, some of the things that should maybe ring a bell, and something for you to have that conversation with your healthcare concierge is what?
So the easy things usually to spot with that condition is you've had a pacemaker or defibrillator implanted.
Okay.
There are just a handful of medications that may make you lean towards thinking you may have that condition.
All right.
You're taking medication for AFib.
All right.
That could be a sign that you've been diagnosed with congestive heart failure. So just some things to look at there. If there's a question, I tell people, hey, let's apply. The worst thing we can say is, no, your doctor didn't verify that
All
diagnosis,
right.
and this is where you need to be.
Yeah, because at
So-
some you'll hear things like your primary care physician maybe saying, they throw out terms like cardiologist and endocrinologist and
Right.
podiatrist, and your head starts to spin. So,
It becomes a foreign language. Well, I don't know what you said,
so
but
do
you
I-
nod your head
yeah,
and you go
and
along with it.
agree. Yeah, absolutely. And then you get home and I'm not really sure. I don't know about John. I know I've come home from the doctor and my wife said, "What'd the doctor say?"
The automatic response is, he said, it's all
I'm
good,
fine.
whether it is or not.
I'm fine.
Yeah.
He did not say that. I didn't take notes.
Right.
All right. So I did call the doctor's office.
Mm.
Let's address some of these myths related to Medicare and Medicare Advantage
All
plans.
right.
I know you know what they say about making assumptions.
Yes, I do.
Don't. Rarely turns out well. So
That's
let's
right.
get through as many of these as we can. Isn't it automatic Medicare coverage at 65?
No. So Part A is, if you've worked 40 quarters or 10 years over your lifetime, Part A will be automatic. You'll get your little red, white, and blue card in the mail, and it will show your Part A effective date and only your Part A effective date. After that, you've got to be proactive and go after every other part of Medicare.
That would include Part B.
That is right. That's why when the last segment we said reach out to Social Security 3 to 6 months before your 65th birthday. That's why you've got to get that Part B activated. There is a monthly premium with Part B, and the government's going to want to know how are you going to pay for that.
Okay. And then some people go, well, I do Medicaid. I don't need to worry about Medicare. They can go hand in hand, John, and work
Yes,
together.
they can. You can have both Medicare and Medicaid. We call those dual eligibles. But you still have to be proactive and get the Part B initiated. If you're on Medicaid, you won't have a premium for B, but you got to get that started with Social Security.
All right. And then and I've heard, John, somebody says, oh, I can help you with that. I've got information for you. There is a fee that comes along with that information. John,
Yes.
go ahead and preach it, bro.
Yes. If any agent, broker says they will be glad to help you for a small fee, run, hang up the phone, whatever it is, delete that email, ever how they're contacting you, because no reputable agent or broker will charge you a fee. I will even go as far as if that person that is calling you or contacting you, if they're telling you they need your Medicare ID number up front before they've done any plan comparisons, do not talk to them anymore. Once they've got your name and that Medicare number, they can put you on a plan without you knowing about it.
And then kind of
Undoing that
takes a little bit of
gets
time.
messy.
What if I say, well, I was working at home all of my adult life. My spouse was working outside the house, but I don't have a pay stub to show my 10, 20, 30 years of work at home. Am I then ineligible for Medicare?
You are not. You become eligible under the work time of your spouse.
Okay. So we're just looking at 40 quarters, 10 years.
10 years. Right.
And you can check that out.
You can do
with
that
Social
at any
Security. You
age.
can call and say, where am I? Have I got my, just be sure the numbers are all adding up right.
Right.
Now, what if I say Medicare's too expensive? I can't afford the deductible. What's a logical next step?
Medicare Part C or Medicare Advantage is the logical next step because, most of our plans have no deductible, whether
Okay.
it's for medical or prescription drug costs, and they have no additional premium to get those benefits. So if you're in that boat where you think, I can't afford anything else,
All right.
give us a call. Let us go through that. We'll do all the prices for you, what your drugs will cost, what you can expect to pay at the doctor for copay. If you feel like you are still needing extra help, there are programs we can refer you to for that, whether it's Medicaid or truly what they call extra help for prescription drug coverage.
You got to have that conversation and just say, this is where I am. Even if it's something simple, I'm a little confused on
Exactly.
what's my next step.
Yeah.
Here's another one. We get this question a lot, John. My husband or my wife and I don't think we should be on the same plan. Do we have to be? with HealthTeam Advantage?
You do not have to be.
All right.
Some people like to be on the same plan, thinking they're keeping it more simple for the household,
Right.
but that may not be what is best medically and even financially for the household. Sometimes it works out where you both are on the same plan, but many times you may not be, and that's quite all right.
Yep.
We look at the individual, every individual, of what's best for you.
And what about pre-existing conditions? Sometimes you say, well, I had a cancer diagnosis when I was 32.
Great question. There are no underwriting questions for Medicare or Medicare Advantage, meaning whatever health condition you have had or currently have will be covered day one.
So there you go. January 1st, 2025, you were good to go. And if you have Medicaid,
they actually work great together.
John, thanks for being with us.